I think we probably make 1,000 decisions in the peri-anesthetic period, or more than that, really. We make an incredible number of decisions in the peri-anesthetic period, and some of them are very simple decisions, like should I stand over here because I'm the least in the way, or where should I face the monitor screen so that I can see it the best, or picking colors for waveforms. Those things are simple. Other things are, do I know my patient on paper? Do I know their history? Do I know what they might need during this anesthesia? And then, of course, when we meet the patient, we go, how do I know my patient in person? Because personality plays such a role in the dose of the pre-meds or the medications that we might choose in the first place. So when we take the time to look at all of those things and combine them together, everything is in a stepwise fashion. But when we get to a certain point, we have to start making decisions based on lab work and things of that nature. So I'm just going to start talking about some cases that I've actually seen where I was making decisions in the peri-anesthetic period that would impact simple things or more difficult decisions where we have to work some very complicated things out clinically. So the first case I'm going to talk about is Chester. And Chester's actually a lovely cat to look at, but not a particularly lovely cat to touch or to work with. And Bengals kind of have that reputation. I go, well, some Bengals are very nice, and I've maybe met 2 or 3 nice Bengals. The rest of them truly are, sort of that feral type of personality, and they can be rather large cats also. So he's a 9-year-old male castrated Bengal cat for surgical extraction today of multiple teeth with resorptive lesions. And he has a history of mitral endocardiosis, and then mitral stenosis developed from that. He has systemic hypertension. He also is blind with retinal detachment bilaterally, and he's been anorexic for a little while now, and the owner can no longer touch Chester's face. Now, no one in the clinic could touch Chester's face, but apparently the owner could touch Chester's face upon occasion. So Chester came on in to have some evaluation done and hopefully fix what's going on in his mouth. So we got some lab work 3 days prior to Chester's presentation, and his PCD was 32, which is about normal for cats. Total solid 7.8, BUN 32, creatinine 2.2. So you go, maybe a little bit of renal dysfunction. His glucose was okay at 102. Now Chester is a very easily stressed cat, and so a glucose of 102 is maybe a little bit lower than I would have expected. But the thing that stood out the most on his pre-anesthetic labs was that his platelets were only 67. I go, oh, well, there's no note on there about platelet clumping, and there's no indication that they did a manual count at all, and sometimes the machines have a hard time with this, and I wasn't sure if Cavalier King Charles have those macro platelets, and so oftentimes their platelet counts are lower. I go, oh, do Bengals have macro platelets too? Oh, let's wait. Let's go ahead and let him come in and we'll see what's going on. So Chester comes into the clinic and we take his temperature. It's 104.7. Now, the first decision is that a real 104.7 and he's febrile, or is that a I'm stressed out 104.7? We need to let you rest for a few minutes and find out. And that's based on what's going on at the time. Was Chester particularly stressed? No, he actually was rather easily handled, and his third eyelids were up a little bit. He looked like he wasn't feeling well. His pulse was 216, respiratory rate was 52. His mucous membrane's pink, capillary refill time appropriate, less than 2 seconds. I go, okay, so first of all, there's some red flags in his physical, and sometimes we pick these up right away, and sometimes we don't. Sometimes it takes a few minutes for things to sink in because the clinic is busy. We're thinking cats have heart rates at 200 anyway. If he was stressed, his respiratory rate could be 52, and it's not uncommon presentation for a cat to have values like that. So we draw some blood on Chester because we definitely want to recheck his platelets. And we pull them, and the machine spits out 72. I go, oh, well, maybe they're clumped together. Maybe we should check them with a manual count. The manual count comes back at 60. So what do we do now? We'd like for him to stay, and we'd like to do the work in his mouth because obviously it's creating a problem for him that would be nice to fix it. We would enhance his life, enhance his health, enhance the quality with his owner, possibly, because